Good to be here. What I wanted to do this morning is talk a little bit about a program that we have called Optimal Healing Environments. You've probably heard about this program. It's something that, no, you haven't heard about the program? So, well, good. Well, then I'm going to tell you about it. The Institute runs a program called Optimal Healing Environments, the goal of which is to help healthcare organizations and others that deal with others that deal with health, learn how to infuse healing into their normal practice. So basically what I'm going to do is I'm going to define healing and compare it and contrast it with cure. I'm going to identify what we have laid out as a framework with 8 domains of an optimal healing environment, from the inner to the outer. And I'm going to describe some of the research, I'll illustrate it a little bit, and then some of the approaches for the delivery of healing-oriented practices and environments. The acronym spells HOPE, and Optimal Healing Environments, or OHE, into healthcare. So healing is the inherent process of recovery, repair, and return to wholeness. And unlike the disease process, it actually applies across the spectrum of our life. It isn't just after you get a disease that you now have a disease or don't have a disease, or do have health and don't have health. It occurs both in terms of retaining our health. It occurs to accelerate the recovery process when we do get ill, so it's therapeutic in terms of injury and illness recovery. And it helps us to return to wholeness and wellness in mind, body, and spirit, even if we can't cure an illness. All right, so let's take a couple examples of what we mean by this. If you walk into the room on the right-hand side of this picture compared to the left-hand side of this picture, you will have very different reactions, right? Not only emotionally and psychologically, but your brain will react differently, and you can measure that on MRI. Your immune system will react differently, and your rate of recovery will react differently. One will produce stress, and one will produce a more relaxing attitude. That external environment is moderated or mediated through the inner environment. It goes through your brain. And how your brain responds to it, how you respond to it, determines the type of reaction you have to that external environment. And so the inner environment cannot be separated from the external environment, and it has to be looked at as a whole in these areas. We define it as a system and a place comprised of people, behaviors, treatments, their psychological and physical parameters. Its purpose is to provide conditions that stimulate and support these inherent healing capacities of the participants, their relationships, and the surroundings. That's the definition of an optimal healing environment. And it's from that we've been seeking to infuse evidence, science, research, and understanding on how do you maximize those components. So in summary, what's the impact of healing-oriented practices and environments? I think these surroundings and systems can be put together in a way that create an optimal healing environment. And there's many areas in which a healthcare setting can pay attention to things like self-care, communication, integrative practices, and the design, that it can impact the outcomes, the performance, the morale, and the costs of what they're delivering. So an opportunity exists when you're doing quality improvement, or if you're redesigning the healthcare environment, to actually change from a more person-centered medical care home and incorporate into these areas. How do you do that? Okay? Well, the recommendation that we have for healthcare settings is that they do 3 things. Take measure, understand what they're doing, take charge, decide to do something, and then take action. Implement the healing initiatives in either a work site or a healthcare setting. And that starts by leading by example, by doing it first yourself and then implementing it in the organization.